Welcome. This is Jay Larson, CEO of the Idaho Technology Council. Thank you for joining us for this weekly podcast of Innovation Matters. We have an enlightening crew with us today that's going to be talking a lot about innovation within their specific disciplines, but I have a thought today. News is something worth knowing that you don't know already, according to David Brinkley. So if you think about that in the context of the political fervor that's happening, especially as we start looking at elections that are going to be coming around the corner and news, it's important and incumbent for us to be able to sit there and know what's news and the difference between news and people's opinions. So that's one thought. But one thing that's very evident right now is Idaho continues to grow, and we've been rated one of the fastest growing states in the nation. And the growth requires capital. So we're going to be talking about capital today. We're going to talk about some of the technologies that have come through Microsoft. And the third area we're going to talk about is healthcare. So joining us first will be Odette Bolano. And Odette is the president and CEO of the St. Alphonsus Health System. Thanks, Odette, for joining us. And I wanted to say this first, Odette. I loved the clinical part of what you bring to the healthcare community in Idaho, and more importantly, the St. Alphonsus system. Can you talk about why that's so important to have that your background and why that's so important?
Yeah, well, this is a personal thought about, I am a nurse by background, and so I really understand the front line. I understand, where our physicians are coming from. I understand where our ancillary, because I was boots on the ground, right, providing care to patients. And I think that for me, it helps me lead in a much different way because I do really understand that clinical side. I haven't been at the bedside for a while, but that stays with you. So I just think it gives me a different vantage point to really relate to those who I work with and that I lead.
Well, and from a person that's all of us utilize the healthcare system at some point, depending upon what's going on in our lives. But having somebody that understands it, that has a vantage point, has bedside manner, understands all of the nuances of the health system, is very encouraging. So we're pleased to have you with us. So let's get to some of this. I guess it would be just an understatement to say that you've been significantly impacted by COVID-19.
For sure.
But if you can, kind of talk about the top areas from your vantage point of things that have happened because of COVID-19 and how it's impacted the health system with St. Alphonsus.
Yeah, if I may just start, 5.5 months ago, and I'll quickly go through this, in early January, we were all watching from afar, right? What was going on in Japan and Italy. And, we started to see first cases in February, but that was, in New York, and we saw some things happening in Seattle. So at the end of January, we started putting our FEMA style incident command center up. And if you can imagine the complexity of healthcare organization, by February, we had over 200 leaders drop everything that they were doing to have a full incident command center, FEMA style, with a myriad of sections and work groups under them. If you can imagine, we began addressing all kinds of things, our policies, our workflows. There's still a lot of unknown about the virus. And you can imagine that in February, we were all scrambling to understand how to treat it, how to recognize it, understand the impact, the comorbidities that affected the virus. And so on a pretty significant short period of time, we were standing up different workflows. We were trying to figure out how we were going to protect our colleagues, how we were going to protect the public. And then in March was really when we started to see major growth in the virus. And we had to make very significant decisions of cutting off all our revenue streams by canceling revenue generating procedures, emptying out our hospitals to get ready for what we expected to be a huge surge. And so we took a nosedive in middle of March 20th was kind of the epic date where we canceled all elective surgeries, all elective procedures, and we're waiting with empty hospitals. We still had people that were sick, but empty beds and reduced all our revenue sources and continued to manage moving as many people that we could, our backside of our organization, our back office stuff, to people working at home. And within 2 weeks, we had over 500 people set up to work from home, right? To create that social distancing.
And so, Odette, on this part, so you basically had a spigot that you had of revenue sources coming in. You couldn't use those anymore. And then
Correct.
people coming into the hospital, you had to sit there and triage. I mean, you didn't let hardly anybody. Unless it was an emergency. I mean, so this had to have been a really difficult time with respect to managing what's happening. And then, as I understand it, this whole kind of a tsunami that was going to hit with you're going to be inundated and overrun with your beds and the support system, ventilators, all those type of things. Did that ever really happen to the extent?
No, I said in March, after, so the predictability models were really, really very in their infancy stage in March, right? And what we were seeing from the University of Washington, which was one of the first models that was out there, is these incredible numbers, right? That we were going to be 100 beds short across Idaho. And so, the procurement of equipment like ventilators, our surge plan, which is a level 1 to a level 5, how would we make more beds, right? Hospitals are used to that. We're used to having emergency preparedness plans for hurricanes and, earthquakes and just different things. But the difference between that and today is that we have been in a state of readiness for 5.5 months. Having an incident command center for 5.5 months is unheard of. We still have daily meetings. We had, so back in March, we were getting ready for these horrendous numbers that we were seeing. And as the models got smarter and more sophisticated, it was like, oh, we already went through our surge, which was a mild flu, if even that. And we had cut off all our revenue sources. So the middle of May was, okay, how do we live in this duality of COVID readiness and start recovering, right? Because what we started to see across the nation and experienced here, even people that were showing up to the emergency room, our volumes across the country were 30 to 40% less. And you know what? COVID didn't stop people from having heart attacks or strokes or other major issues. And what we started to see is that the patients that were showing up to the emergency room were much sicker. They had delayed their care. So our admission percentages out of the emergency room were much higher. And people had compromised their care. Things that if they would have come in when they were having the first signs and symptoms, they could have potentially, some, not all, had a better outcome.
Yeah, it's kind of like what's
going on.
Kind of like you have a toothache, but you don't want to go because I don't want to go see the dentist, but you have to put it off, and then it becomes much more significant issue.
Yeah, right. Exactly.
Yeah. And now let me ask you a question. Now, this kind of begs this question. I'm not sure I wanted to go this way, and if you don't, that's fine. I'm kind of, with all of the things that are happening right now, and you were just talking about the percentages that come, and you know the percentages, and the University of Washington, all those things. What seems to me is that we've kind of we need to be really smart about how we contain and do everything. But it seems like we've shut a lot of things in the economy down where it's almost like we turned it down and now we think we're going to turn it back on. And it's really hard to do that in our type of, we've changed a lot of things, but do you think we overreacted, or do you think that these are, what's the balancing act we need to have?
Yeah, that's a great question. I will tell you just subjectively my thoughts on that. We didn't know what to expect. And what we were seeing across the country and what we didn't know, I think that everybody did what they needed to. Now we are starting to go through, now we're not calling them surges, we're calling them waves. We've seen an uptick and we've seen, our numbers go. So probably in the middle of May, our numbers dropped significantly, maybe 2 or 3 patients in here at any given time with COVID. And so we started our recovery. How do we stay ready and recover and make sure that people are in our facilities getting the care. I mean, also our clinics shut down, right? We were seeing mainly emergencies in our clinic. And so what we are doing now is that balancing act. And I think we will not go back to where we were in March, that we turned off everything. And you can see across the country in Texas and Arizona, et cetera, that people are trying to manage in that duality, right? How do you still provide care for people who have care and not scare people not to come back to the hospital, and yet stay ready for the surges that we're having? So we're posting on our website, Ask St. Luke's. We've been working very collaboratively what our numbers are. And, our numbers probably 3 weeks ago were in the 60s of hospitalized patients, which were significantly higher numbers. We're now in the 40s. We see these up and down. And, I know there's a lot of controversy on what is really what we need to do, but I say we have to trust the science, and we do see evidence that social distancing, physical distancing, masking, and hand hygiene are critical. And the silver lining in all of that is, in the Southern Hemisphere, we are starting to see, they're going through their flu season, and they're having a mild flu season because people are practicing that. So the silver lining is that maybe we're learning how to go into the flu season a little differently each year, and learning more about how to protect people, because there are hundreds of thousands of people that die, right, of the flu across the world. So we're learning some things. But, what we're also concerned about is we need people to take those precautions, because as we enter the flu season, the symptoms are very similar, right? And so we have to figure out who's got COVID and who's got the flu. And so, we want people to get vaccinated. We want to make sure that we're taking precautions as we're gearing up for the flu season.
And they always say that information is power, right? So when you can start delineating how you can quickly understand how you can control spreading germs and the type of things that relate to COVID and also the flu, and understand the differences between the two, that's going to help you be able to provide better service and hopefully less harsh flu season. I like that a lot. Yeah. So on the Idaho Technology Council board is Mark Winstrom, who is your vice president of information technologies. He's fantastic. I wanted to ask you a question. How have you optimized technology during all of this? So what's helped you through the technology arena?
Yeah. So a few things, like getting everybody, over 500, not everybody, but over 500 people to work from home, in 2 weeks was a monumental initiative. And our IT team was fabulous, making sure that we could set people up. The other thing that we did is we've always talked about telehealth. Telehealth has been out there for 10 years, but probably in a 6-week period across the nation, we made enormous strides, more strides in telehealth and the use of telehealth than we have in the last 10 years. You might ask, well, why? Well, you follow the money, right? The reimbursement for telehealth has never been there. And so physicians have not really adopted the technology. The virus made it very compelling, and the Medicare and the payers began to pay for telehealth during the COVID. And so when we were using maybe 8% telehealth, and it shot up to over 30% use of telehealth in just 6 weeks, right? Tells you that when people are getting reimbursed, and what you're reimbursing a physician is for his talent, his knowledge, and his skill set, whether he's sitting on a screen or whether you're in front of him. And so that allowed us to quickly deploy telehealth to all our 76 clinics. We also started using iPads to do virtual rounding, so we would protect our teams from going in, or limiting the amount of exposure that they had in a COVID room, because we didn't know that much about the virus and how we needed to protect staff. And if you remember, we had huge shortages of personal protective equipment across the nation, right? We were not ready for this. And so limiting to the actual care that was needed and trying to do as much as we could from a virtual perspective in the hospital was also important. And a popular policy that we had to put in place is limiting visitation in our hospitals. So virtual visitation with families of their loved ones, because we couldn't really allow, with the exception of a few areas like a pediatric patient or a patient that's delivering or an end of life situation. We didn't have visitors and still don't have visitors in our facility. So using FaceTime and virtual visits, so people could still connect with their families and the loved ones has been a critical piece for us. Increasing, we have InQuicker, which is a digital way that people can make appointments online. That's really been helpful, and we've expanded that significantly. And then we're deploying something called Care Connector to help limit people in our waiting rooms and how we can, make sure that we understand how we can see them safely in our clinics, and also using what we call a queuing system that we're putting in place. The other thing is we're instituting, and many hospitals already have this, we're doing it as a health system, but our screening technology for when people or colleagues or visitors that are allowed in come into our facility, how do we use technology for our screening processes to, do all our screening about the questions we need to ask and temperature checks for people that are entering into our hospitals or clinics.
Really, that's some amazing how you've utilized like 5 or 6 different technologies. Do you think that the Medicare or Medicaid type reimbursement will continue to pay for telemedicine?
Yeah, well, they've extended it, right? So we have a lot of advocacy in the American Hospital Association, the Idaho Hospital Association, American Medical Association. We're really advocating that this now needs to be in place consistently. I think that there will be exceptions. I think that, they've extended it through December, their current policies. We'll see where they go, but we do believe that it is critical to keep this in place, especially in Idaho. It's a rural state, and we need to be reaching people as best we can.
Oh, it's a fantastic tool for Idaho, isn't it? So, yeah. Odette, anything else that that's kind of any burning opportunity that you'd like to talk to about things that are happening within St. Alphonsus?
Well, I just, would say that, we have an incredible team who is really focused and committed to serving our communities. The amount of change in our workflows to make sure that we serve our communities well has been just amazing and humbling to watch. I think, our staff, we've all been affected personally and professionally, and you can imagine in the stories that you're hearing about the effects in healthcare, watching and taking care of these extremely sick patients, and what that does while you're still dealing with how COVID is affecting your personal life, right? So people to be just in the moment, committed to serving our population with reverence has been incredible for us to watch. And so I just want to acknowledge the 6,100 people that work for us and everything that they've done over the last 5.5 months and will continue to do.
Well, thank you. And I think the reverence part of all of this and the respect that's needed for us as we navigate uncharted waters because of COVID-19. But more importantly, thank you to you and your team for the way that you help serve our communities and the inspiration that you bring and the commitment you have. We really appreciate it, Odette.
So, thank you. Appreciate it.
Thanks to St. Alphonsus and your team. So we'll have you on another time. Thank you so much, Odette.
All right. So, thank you. Bye-bye.
We'll see you. Now we're going to move to Alex Barr, who's with Microsoft, a director over account technology. Alex has moved to Boise. Alex, how long have you lived in Idaho?
Sure. Jay, I have been moved to Idaho in 2015. And so I had been getting to know the technology scene and working in a couple different at that time consulting capacities, but had obviously worked very closely with Microsoft Technologies and had known that, and then decided to cut out the middleman after a certain period of time and just go direct to Microsoft. So that's my role there is director over the technology strategy. So work with a lot of Idaho clients that from mostly the big to medium size. So we've had a tremendous amount of change that we've had as well within this time period that has made it it's interesting to say that we've had it's similar to Odette, that we had an enormous amount of change that we had to put together for within a very small period of time.
Well, talk to us then about the change. And Microsoft obviously has its finger in so many things as one of the top companies in the planet. Mm-hmm. Talk about what some of the top areas that you've helped companies adapt because of COVID-19.
Sure. And it was one of the biggest challenges that we'd often put. I'd spoken with sometimes CEOs of companies who would say, well, when I would have conversations, say, we understand your pain. We've had to move 163,000 of our employees within 2 weeks to a work from home capability, many of which who did or worked in critical essential services functions, and not as easy. And he said we haven't worked it from home in an 80-year history of our company.
No, it's crazy, isn't it? Now it's like 5 months. How many times have you been in the office? 5 months. It's you're gonna get counted on one or two hands, right?
Exactly. We've been using the time to people are going and doing remodeling, so that's stuff that would always have bothered us before. But no one's there now. So we found for us, I'll just say this, and then going into the customers, we had to, again, shift all the roles from on-site to remote. And we went in the process of the viewpoint that there was a lot of confusion at that time. There's a lot of lack of knowledge. People didn't know what was going on. The left hand didn't know what the right hand was doing. So we were shifted to doing senior management, our senior leadership team, to giving weekly and often every other day updates on where things are going globally and in regional status. We started heavily leveraging, we already used it very heavily, our Teams platform, which would be like a Zoom, but better. And that it has those capabilities. So we took that and we made that, rolled that out through every sort of activity. So all internal activities, things like that, shifted our organizational wide announcements and meetings to all Teams based, made everything recorded, right? Because how many times have we seen that where people say, I can't join this right now. I've got all these other things going on. It was a big problem for us, candidly, because we had, I know it's been challenging, and not to be insensitive to a lot of the other companies that have had to deal with this, but for Microsoft, we saw company-wide over an 800% increase in utilization of most of our services. And Teams, which we use for collaboration and video conferencing and stuff, went from, I think it was from 14 million average daily users to over 80 within a 2-month period. So that was, and then all the other cloud from home, work from home capabilities and that sort of stuff. So it's a real challenge to go ahead and to scale, even when you have the right people. And so we were happy because we'd always said to our customers, we'll be able to scale to that level, to go from here to here, no matter what. And so our customers said, okay, great. Now let's prove it. We're going to go ahead and we need to increase by 10.
Yeah. But you sit there and you're going, and that increase that you just talked about, I mean, how would you anticipate, because you had never thought that a COVID-19 was going to come and just change the way we operate, the way we do business. Like when Odette was talking about telemedicine, mm-hmm. I mean, just think about how easy that's made it. So you can go to the doctor, but you can do it right there. You can talk to them. You don't have to sit there and drive down, find a parking spot, go check in because of all the COVID-19 stuff now. So you have all these complicated things. Sure. But if you talk about some of these things, like, by the way, Teams is awesome. It's a fantastic tool. What do you see as what customers have changed, and what's been the biggest change for customers that you've seen that they've been asking you for because of the change over the last 5-6 months?
Sure. Well, we've had a mix primarily of a lot of people saying, how can we go ahead and do customer facing? They want to see how they can, if you will, triage stuff. Can they shift some of their load that they were taking care of on a retail perspective or customer facing? Can they shift that to an online type of environment? So we've been spinning up large amounts of capabilities. Some of them were even like triage, like you would do chatbots or things of that nature. We would bring in where people say, look, I have these things coming in. Can I answer simple questions on that one instead of getting overloaded on the phone or or those other things. Those would be common ones we would see where people were asking for it. Actually, several clients we had here in Idaho, large ones, they basically, several of them, some of them were manufacturers, right? And some of the semiconductor and other industries. And they'd said, we're basically having to empty things out. We've got tens of thousands of our employees. So we rapidly were able to take one of our technologies called HoloLens. It's like a virtual reality. You put on a headset, that type of capability. We tied it in with their Teams capability. Luckily, we'd already had some POCs with that company, so it made it a little bit smoother. But we still had to move rapidly to change that. So that would enable, so they would things like they could do vendor assistance to on-site personnel. So a vendor person, let's say machine 1 and 2 broke. The only person who knows how to do this is a remote, repair technician, if you will. But they can't come on site because there's no one's allowed to come on that's outside the company. But yet this is stopping thousands and potentially millions of dollars worth of business, right? Especially in a manufacturing context every day. So we quickly were able to have it where the person who didn't know the capability from remote technician put on like the headset, would be able to connect through the Teams, through video calling as well, and be able to do it almost like out of that bad Disclosure movie way back when, where you could move one hand and move the other to the side. You could do a circuit diagram, if you will. You could look at the wiring and that sort of stuff. And then the person would also be talking in another window and saying, yep, up there on your left, that's it. Go ahead and grab out that chip part and put in the new one that's not burnt out. And so it's that type of collaborative capability that we're able to bring. We're able to scale that up and have it from, thousands of people use it here in Idaho, across the US, globally. So that's an area where we saw that sort of activity, plus an enormous amount of people moving home. Challenges like, how do I do phone calls, right? Not everyone has a cell phone or work-related one. They don't want to do that. So we were through Teams, we're able to, since it's cloud-based, we're able to scale that up to tens of thousands, hundreds of thousands of types of lines that are cloud-based telephony. So people wouldn't know. They'd have the same phone number that their customers were calling in on every day. It would go seamlessly, would go ahead and unify communications, so be able to ring them on their laptop if they wanted to. They could have it on their cell phone, that sort of stuff, just by having the Teams app. So, and then collaboration was a common one. We had a lot of our productivity apps like OneDrive or others, where people said, I need to be able to continue to share, but with high security, intellectual property containment, that sort of stuff. So it's, I could go on for quite some time, but it was a challenge because it wasn't just one customer asking for it. It was every customer asking for it.
This is great because this is all stuff that's taking place right now, real time. Now, change this a little bit. Now you put you're going to say, how is this going to impact the way we operate 5 years from now? I mean, any thoughts about that as far as how is this going to be? And let's kind of be futurist for a moment, if we can. Alex, talk about that.
You bet. Yeah, I mean, the bad joke that I've had lately was my friend that works for a real estate investment trust, and he's like, "You think you've got problems?" He said, "We're trying to figure out where the commercial business is." But what we see is initially there was always a big hurdle to people doing things, right? There was a lot of business as usual. Well, we've done things the way for 20 years. Why would we change? But by being forced, if you will, the inertia, you've now removed a lot of the friction in people moving towards online solution. We're seeing this across every vertical I can think of: retail, manufacturing, government. We've seen it in every aspect. We see a massive change. So with that being said, we're seeing that a lot of our customers have seen interesting things like reduced costs, right? I'd had the head of a large property management company that does doing business here in Idaho, and said, I don't know how much we need to have as a footprint when we come back. I think he goes, I'm just looking on simple things like our utility and other bills and things that have come way down. So I think we're going to see that as people become comfortable working from home. And I won't say everyone. Obviously, there's places where people have to have hands-on touching or interaction, right? That the brick and mortar type of economy, and you can't all be electronic. But what we've seen and we anticipate is we've had internally, and speaking with a lot of our customers, the productivity drop for those employees that were able to do work from home there was a little bit of blip and a disruption in the first month on that one. People getting used to it. How do I do this? I'm confused. Who do I talk to? But that got smoothed out very quickly, both within the internal customers and within Microsoft and other presumed providers of a similar nature providing it. And now the productivity levels that went down had quite blipped are back up. And in fact, they're seeing almost no change for most of our customers that we've seen. And so that hurdle, and now the management's looking at that and saying, can I go ahead and can I give them the flexibility to work remotely? Yes, I can. And also the ability that we can apply metrics to it. They can say, here's how efficient they were, if you will, at their job or whatever it may be at that time. Now let's snapshot it against today. And so we're able to do that consistently now. We're able to see that capability with our customers and provide it to them and say, here's where you were for your overall output, right? Whatever the metric may be. Here's where you are today. And looking at it saying, this is like the width of a Wheaties flake here. I'm not seeing much difference. And so I think that we'll see going to a future, a huge amount of where flexibility, a more hybrid. I don't know that we'll ever have it where people will continue to work from home. There's lots of reasons for people to interact, but you'll see, we believe that there will be much more of a hybrid and continuous use of these services.
Yeah, it's kind of this mobility, Internet of Things. I mean, it's forcing us to be able to use it, and it's really helping us move to a more efficient state, so we can optimize technology at a higher rate to create solutions and to be able to work closer with our customers, right? So, yeah, I like it. I like it a lot, Alex. Alex, thanks so much for being part of us. We're very happy to have you part of the Idaho Technology Council as well. So, thanks for all you're doing and the knowledge you're bringing to Idaho. So, appreciate you so much.
No problem. Happy to be on board, Jay.
All right, thanks, Alex. All right, now we're going to change to the Capital. Now is the last segment, and we have from Sorenson Capital, Bert Roberts. Bert, welcome.
Hey, Jay, great to be here.
So Bert, it's fun always seeing you. You've been making your sojourn to Idaho on several occasions, right? Because you're based out of Utah,
Yep.
But it's almost like you have a second home here, right? I mean, you're here. How many years have you really been making the trip up to Idaho now to be able to continue to look for investments like the one that you made in Cradle Point and other ones?
Yeah, I'd say it's been now 9 years. We've been consistently coming up there, and it's easy to get there. People embrace us, and great, easy to network. So it's really been productive to spend so much time and get to know ITC and you, of course, Jay.
Yeah, well, thanks, Bert. Okay, so talk a little bit about now we've heard from St. Alphonsus Hospital. We've talked to Microsoft. Now we get the chance to be able to talk. How has capital been impacted over the last 6 months?
Yeah, you betcha. I can cover that, and it's tough act to follow with how important the healthcare system is, and obviously the juggernaut that Microsoft is. But it has been really interesting the past 5 or 6 months, and maybe I just say I think we're probably not unique in terms of capital providers, whether it's private equity or venture capital, but I think most private equity firms really adjusted pretty easily to COVID, the impact of COVID. And the reason being that most professionals at firms are used to traveling, working remotely, on the road, and things have to get done even when you're not in the office. And so, in our case, we shut down the office on, I think it was March 13th, Friday the 13th. And we have not reopened, and we opened up the virtual office on that Monday the 16th, and we really didn't skip a beat. I think it's always great to have the camaraderie, to be in the office and to pop into someone's office, to brainstorm or creatively collaborate. But it was really pretty seamless, and it also helps when you're only 30 or so professionals versus Microsoft has 100,000, or the hospital system has thousands. So that certainly made it easy. So that transition was a good one. And then I think, like a lot of PE and venture firms, we kind of marched into the assessment phase, which was, goodness, this COVID it's real, and it's going to have ripple effects. And March and April was mostly just making sure that we could keep our arms around our portfolio companies, both software companies and healthcare companies, and just daily check-ins, weekend check-ins, making sure they were capitalized, making sure that there were no bank covenants violated, and that kept us pretty darn busy, right?
March and April. And I like it because you kind of have three major areas that you focus on, right? You have healthcare, technology. What are the focus areas for you? And have any of those three industries been impacted, or have they been accelerated because of COVID-19?
Yeah, great question. So on the healthcare services side, the reason we've just been very active there is those tend to be pretty defensive, businesses, and it's true. And we knew we were due for a recession or an economic, downdraft. We of course didn't underwrite or anticipate a pandemic, and so those healthcare services businesses, like Odette's healthcare system, was impacted pretty severely for kind of a V-shaped, time period because there was shelter in place. If you were a patient looking to get to the dentist or a dermatologist, you physically couldn't go. But those types of services have reopened. Clinics, offices have reopened, and those companies have bounced, way back. So I think the thesis that they're very, defensive and they do well during a downturn still holds. But it was, we had about 4 or 6 weeks where it was pretty stressful because you don't anticipate some of your companies not being able to serve their patients.
Right.
On the enterprise software side, it's been very interesting. I would say, as we are now 5 months out of this, with exception of maybe one or two investments, all those companies have rebounded and they're actually at where they should have been, pre-COVID, and so they bounced back really dramatically. And that's because the types of enterprise software investments we make, they tend to be infrastructure, mission critical software, so it's not consumer discretionary related. They tend to be software products that if a Fortune 500 business no longer pays for it or doesn't use it, they can't operate, like a database or a content delivery network. And so our investments during COVID have performed really well. And there's been a couple notable ones like Fastly, which is a CDN provider that, one of its clients is TikTok and some other high profile streaming services. That business obviously has gone through the roof because everyone's at home, supposedly working. Sometimes they're just, downloading content. I think so. I think overall we've weathered it really well. I think where you're challenged is if obviously you have if it's travel related, if you're exposed to real estate, there are some sectors that have just been really hard hit, and just thankfully, knock on wood, we haven't had much end market exposure to them in our enterprise software businesses.
Thanks for that. Thanks for dropping the name TikTok on that, all the way through, because that's obviously been pretty a lot of buzz around that, right?
Yeah, you forgot to ask Jay. You forgot to ask Alex about TikTok.
I should have. Dang it.
Tongue in cheek.
That would have been a great discussion point and discussion about who's going to get TikTok, or have they already decided that? I'm not sure. But, the U.S. portion of it. But anyway, let me ask you a question here. So this is kind of fun. You've been coming for 9 years. You've got, by the way, great partners within Sorenson Capital, just some amazing talent there. As you've been coming up, what kind of things can we continue to do, or we need to do, to be able to make sure that we provide really good paths for early stage companies, mid-sized companies, early stage A round funding and so forth? What kind of things can we do, Bert, that will help Idaho?
Yeah, I think about this a lot, Jay, and goodness, it's been just really impressive and fascinating to see what's happened in 9 years. And you've been there for all that time, and it's really amazing the transformation in those 9 years. And so when we first started coming up there was a lot of this angst and worry of, how come Boise especially, how come Boise can't become another Salt Lake City? And there was, I think there was, I wouldn't say a chip on the shoulder, but there was, there seemed to be an echo chamber of this, when will it happen? When will Boise emerge?
Yeah, right.
Obviously, 9 years, it happened, right? And what's remarkable to me is that it's happened without, really much in-state capital. And it's happened with, maybe a state government that's not as pro-business or aggressive as like Utah. And Utah has certainly had that aspect. And so you kind of assess where, Idaho overall, especially Boise, is at. And there's this ecosystem that is really built out. And you've got billion-dollar, valuation companies that are getting funding and they're having liquidity, exits. And, there's this, follow-on effect from founders, employees that do well and they go start their own businesses. So that has always been the flywheel, in my assessment, that, you always had Micron and Hewlett Packard that created a great foundation. But what was missing for many years was just a handful of big outcomes. And they all came in the last 5 or 6 years with, Truck Stop and Clearwater and, Count and T-Sheets. And once that starts happening, you get this flywheel effect. And, it will continue. That's what happened in Utah, 15 years ago with Omniture and Pluralsight. And now that is just, it's unstoppable. And I think the same thing will happen with Boise because now you've got this critical mass. It's identified as a great place to live. It's affordable, high quality of life. There's engineering talent, and there's enough ecosystem of engineering talent, of entrepreneurs in partnership with the university, ITC, Trailhead, others, where you have, that foundation. And my advice is don't get complacent, right? Don't get cocky. But I truly believe that Boise, especially Boise, is going to be one of the, interior West epicenters for enterprise software and technology, going forward. COVID or not, it may even accelerate during COVID because people just throw in the towel and say, I'm out of the Bay Area. I want to, move to Boise. And that can be good or bad if you live in Boise. But I really think it's firmly entrenched.
That's great. And what's so interesting, Bert, is that the, after growing up in Boise and seeing going through the 90s, the Boise marketplace, for instance, just itself was probably stronger than Salt Lake City.
Yeah,
because it had the major corporations that were here, but because of the movement that you said, and this is what Scott Anderson told us when we went down there, probably in 2010, he was saying it took a while for them to be able to work on the state government and the governor's office to be able to get a coalescing voice to be able to grow, put money into things like the fund of funds,
Yep.
which kind of helped catapult some things. It was about $200 million to be able to help catapult funding. And now you take a look at all of the companies that were funded, the companies that you've invested in, other companies, and it's amazing the infrastructure that's taken place here. And I think that was really, you could see that. Now, I loved your point. I think that's happened now in the Boise and the Idaho area. And our objective is that we have to keep it going, though. We have to keep that ball, the inertia going forward, don't we?
Yeah, for sure. And, but not to dwell on Salt Lake City, but I moved here 18 years ago and people were wringing their hands 18 years ago. They were saying the same thing, saying, gosh, how come Salt Lake City can't break out? We, at one point we had 2 of the 3 largest software companies in the world were based in Utah, Novell and WordPerfect. And 20 years ago, Utah became pretty irrelevant, right?
It was. I moved down there in 1998, run, Verizon Wireless down there, right? And it didn't have the same fervor, but it had so many things take place, from the Olympics, from the .com bust, to all those things that helped focus a lot more attention. And then the coming forth of a lot of capital companies like Sorenson Capital, because that was a success that took place that created Sorenson Capital, right?
Yeah. So Sorenson Capital, really the founding roots are there was a group of executives from Bain Capital in Boston, and some of the founding team members of the Salt Lake Olympics. And it came together and said, wow, there's Utah is poised to do something really special, especially at the Olympics. And that's that was the thesis, and it's been just super fun to be part of that success story the last 20 years. But the first few years, people said, okay, well, you're probably hope it comes.
A lot of naysayers, right? And we had the same thing where we had some arguments about the chicken and the egg syndrome that was saying, no, we don't have any companies to invest in. But then another person saying, well, there's no capital. So both are right? Yeah. Because you don't have any. You have to get those people who are really taking risks. Entrepreneurs are growing. They've started the companies you just mentioned, and like Cradle Point, a great HP story that came out of HP, and then it has someone like George Mulhern that's doing extraordinary things with a leadership team that's grown amazing things. And in their category, they're actually the top in the world in their category. So
that's a fantastic business, and thrilled to be associated with them. So we will continue our involvement in ITC in Boise, and maybe involve more driving than flying. And that's one thing I just mentioned in conclusion. I mean, where I think, anything that any business that is helping to digitize or, helping a customer, go online or take advantage of work from home is going to flourish, right? I think what I see is I think business travel is going to be materially different. I mean, there's always going to be a need and a place for a face-to-face if it's a first-time relationship. But if it's a follow-up, and you don't need to do the circuit, Boston, New York, and Philadelphia. If it's a follow-up meeting, Zoom is been completely validated. It is very, very effective, or Teams, or whatever tool you have. And so I think business travel is going to change significantly. And I think this makes people more, I feel bad for the travel industry. I think pleasure travel is going to bounce back because people are curious and they want to explore.
Yeah.
But, not having to get on a flight to follow up with someone that you've met with, 3 times in the past, year, that is a major efficiency gain.
It is. And Bert, we all know several people said you need, 10 years ago, you need to go to the Bay Area, or we need to go to Silicon Valley because we need you to be close to us. Mm-hmm. Well, those days are no longer that, because you can just jump on a Zoom, and this technology has become very effective in the way we do business. So
indeed.
Hey, Bert, you've been awesome. We'll have you on 6 months from now, something like that, and give us an update about things that are going on. Does that sound good?
I love that, Jay. I appreciate the time.
We really appreciate your support of the Idaho Technology Council and the work that you do to help capital grow in Idaho. So thanks so much, Bert.
Thank you, Jay. Back at you.
Thanks. Thank you very much for joining us today. We have this has been a great opportunity for us to hear from some of our industry leaders that have helped us grow an innovative economy in Idaho. We continue to help you follow our YouTube channel on www.idahotechcouncil.org/innovation #matters /. Sorry about that. That's a long word. I wanted to also make sure that you knew, again, David Brinkley said, news is something worth knowing that you didn't know already. Let's continue to make news from the innovation that comes from Idaho entrepreneurs and entrepreneurs. And just as a side note, today I get an opportunity to say thanks to my wife, who we just celebrated our 38-year anniversary. And it's awesome when things happen, because I have to say this because a lot of things happen in my life because of the innovation that took place in our relationship. So that's very good. Let's talk about next week. Next week, we have the opportunity to listen to visit with Christy Sosserman, CEO of Auction Frogs, Nick Aldinger from the CEO of IBL Events, and Dijon Noednev, founder of Panaton Software. So please join us next week. And again, thanks so much to Bert Roberts, Odette, and also Mr. Barr from Microsoft. This is Jay Larson with the Idaho Technology Council, keeping you connected with industry and government, because in Idaho, innovation matters. Thank you.
Thanks, Jay.
As we adapt to changing times where organizations and government agencies are working remotely, it is increasingly important for us to stay connected with local tech companies like Cradlepoint, Truckstop.com, Experis, FlexTrax, Idaho Central Credit Union, as well as Mayor Debbie Kling and Mayor Rebecca Cashmer. Isn't there a direct correlation usually with the goods transported across the country and the health of the economy and possibly going into a recession or something like that? Is there a direct correlation there?
What's cool on the technology side People are having to, like the webinar usage, you talk about the bandwidth that just skyrocketed.
To discuss what Idaho's economy and government leaders are doing to ensure Idaho's economy weathers the storm.
Idahoans also have a culture of taking care of each other. We have a culture that includes doing things intelligently and the right way. And I think that's part of what's going to see us through.
So I should not just limit it to the United States, to the world. That is fantastic.
Yeah, I don't want you to sell us short, Jay. Come on.
Yeah, that's right. Thanks. This is Jay Larson with the Idaho Technology Council, keeping you connected with industry and government, because in Idaho, innovation matters. Innovation matters. Innovation matters. Thank you all, and be safe out there.